Doug, it's good to see you here at the AdvaMed event. Is this your first one you've been to?
This is the third one we've
Third
been
one,
to.
okay,
Yes.
great. And we are driving LungPacer. I know this is the latest chapter with what's going on there. You've had some tremendous progress over the last few months, so share it with me.
Sure. So we were very fortunate in December to get our FDA approval over
PMA.
FDA PMA approval for a first-in-class device.
Early?
So it's never been done before. That's
Early?
right. Early, over 6 months early. And shortly thereafter that, we were able to establish a new code for the product, basically a new technology add-on payment for the device, which will be additive to the DRG on the order of $23,000 per patient treated. And we just had a successful CPT panel, and we expect to have those codes for physician payments available next year.
So some pretty good yardage made up there.
Absolutely.
Right? Now, you've been incredibly successful in this industry, and I think a good part of the market understands the LungPacer sort of genesis. But what I want to look at is, when we think about LungPacer, you had shared some stats recently about patients who are on respirators.
Yes. A patient's experience when they're on a ventilator is really tough. It's very clear that they suffer, they're isolated, they can't speak, they can't eat food, they can't even smell the smells around them. They get depressed very quickly. There's literature that shows that about 60% of patients that are on prolonged mechanical ventilation will consider at one point that they'd rather be dead than alive. So they really have those dark thoughts along that journey. And 30% of those patients are going to have PTSD for 90 days and longer after their time off the ventilator, or they will remember a period of time when they couldn't get enough air, and they will be believing that they're back on the ventilator again. So it's really a tough existence for these individuals. So our mission is ideally to get these patients off the ventilator faster, to shorten that painful experience that they have to endure, and hopefully get back to normal, healthy lives faster.
Well, you want to talk about a mission. Let's call it the mechanical function of the technology, just briefly for those who might not have been following it. What does it do and why is it important?
So when a patient goes on mechanical ventilation, they're often sedated. That helps make them more comfortable as the tube is placed down their throat to help them breathe. That sedation stops their primary breathing muscle, the diaphragm, from working. What people didn't know when ventilators were essentially invented in the 50s and 60s was that when the diaphragm muscle is rested for even just a short period of time, it loses its muscle mass quite quickly. Can shrink up to 50% in just 2 days, which is extraordinary. So when it comes time for a patient to be able to breathe on their own again, that muscle's atrophied to the point where it can't sustain prolonged breathing. So they have to go through a long process called weaning to build that muscle back up. What LungPacer is doing is we have a device that's placed at bedside. It is a neurostimulation therapy that can exercise that muscle even if a patient's sedated, if their brain can't tell the muscle to move, or if they don't have the energy to move it themselves, they're weak, they're tired, we can activate that muscle, rebuild its strength, and help them get off a ventilator.
How long on the normal distribution curve do patients stay on mechanical ventilation?
Yeah, so about 38% of the patients will actually still be on the ventilator on day 5, and that's the population that we studied in our series of clinical studies because they're considered most likely to have trouble regaining the ability to breathe again on their own. And in our clinical trial, we showed that we could shorten their time by 3 days, and we could reduce the risk of being on a ventilator at day 30 by over 35%. And then in the groups that we treated, we also saw that there was a reduction in the percent of patients at risk of going back on a ventilator of 46%, and a reduction in patients requiring a tracheostomy, which is a surgical procedure to put a breathing tube in their neck, by 46% as well. So really important outcomes for these patients.
Wow, so that's been recognized on the reimbursement, it's critical. It's been recognized on the CPT code, that $23,000 to a hospital, and that's not voting efficiencies or anything like that. This is clear cause and effect.
Exactly.
And economics for a hospital makes sense. Now, I know you're also in the middle of fundraising, and what I want to do is I want to talk to the audience about this commercial build eventually you're going to do near term. You're in the middle of a financing right now, right?
Yes. We are raising the funds, our Series C, to build out our commercial team. We've hired some of our initial commercial leaders, and they are in place now building the rest of our organization. We have started our building our commercial funnel, so we've had outreach to a large number of customers and are working them through the value acquisition process and through those committees. And ideally, we'll have our first customers using the LungPacer product by the end of the year, with our soft launch in January next year.
So if I'm a commercial person who needs a mission to get behind, who is ready for a climb the mountain sale, right, into an ICU, very clinical sale, driven sale, but has a real value to the hospital, I should lean into LungPacer.
Absolutely. Yep, we're looking for talented individuals. They know the critical care area. They can talk the technology, but they also know how to sell to the C-suite. They understand the financial value proposition for the technology, and hopefully they have the passion that we do for the patients.
Yeah, the passion will be easy to sniff out for sure.
Yes.
And then finally, we're in October 2025. You and I get together a year from now. What do you hope you accomplished in that 12 months? And what do you look forward to after that?
So 12 months from now,
Right.
I hope that we have a number of clinical institutions across the US that have adopted the LungPacer air-based technology to really change their care practice for these patients. And I'm highly confident we're going to have a lot of success stories. I know we talked earlier, but our first patient treated in our clinical study had said he wanted the plug pulled on his ventilator. And after we convinced him to enroll in our clinical study, and 2 weeks later I was at his bedside and he said, "You saved my life." And so I hope 12 months from now, Joe, that we have a number of patients who feel that we saved their life. Because that would be incredibly rewarding.
Hundreds of them, I bet.
Yes, exactly.
Yeah. Well, as usual, my friend, thank you
sir.
so much.
Great seeing you, Joe.
Always.
Okay.
I'm Joe Mullings from the floor of the MedTech Conference, San Diego. Be well.